We know that, last year, I think, I can't remember when I was last here speaking with you all, but we were in the middle of trying to figure out, okay, we have a supply chain that's not keeping up relative to testing and making sure that we can do adequate testing and contact tracing, et cetera. While that still remains out there, it seems like the attention has definitely shifted to the vaccination realm. But yet we are dependent upon our ability to continue to do active testing and making sure that people get in to be tested as soon as they have potentially been exposed or feel any type of onset of symptoms, so that we can continue to tamp it down from that preventative side of things, as well as doing all of our non-pharmaceutical interventions, wearing our masks, washing our hands, maintaining our distance, all that good stuff. From the overall, from my perspective, we have continued to see the fallout of a lack of a really kind of a coordinated federal program or plan for how we were going to address this. We have known for a while that the vaccine was a strategy that the government was investing in with the original CARES funding to make sure that we could accelerate the development and distribution of vaccines. At the same time, there wasn't a uniform process by which that was going to occur. So as opposed to being one type of program that would be applied from state to state and community to community, it was really then deferred to each state to come up with their own plan. So it's amazing the number of emails I get from folks with concerns or complaints that, like, my friend in such and such a state has actually already received theirs and I don't have mine, and sort of not understanding. I think we've done ourselves a disservice of not having some amount of consistency and continuity from jurisdiction to jurisdiction, because then we just have more questions than we do answers. And of course, that's only exacerbated by the fact that we don't have an adequate supply chain. Right now, the state receives maybe about a little over 100,000 doses of vaccine a week. But the demand in order to keep up with some of our goals for vaccinations means that that's probably only 1/3 to 1/4 of what we really need in order to make sure that we can get vaccines to everyone's farms who would like one. And so that continues to be a challenge that hampers our ability to do that. And I don't know if you all have seen any of the letters that the Board of County Commissioners anyway have sent off to the governors expressing concern about sort of how this rollout is happening or not happening. And that is, when it came to the original testing and contact tracing and capacity for quarantine and isolation, there was a lot of deference to the local jurisdictions to be able to stand that up and make that happen. So when it basically in the rollout of the vaccine piece of it, there was this kind of shift at that point in time, and it happened at pretty much right around the same time that the governor and the Department of Health switched directions into the roadmap of recovery, and it really sort of shifted a lot of that local deference and decision making back to the governor and the Department of Health, which left us kind of in this informational void and an area where we're not actually as involved as we would like to be. And in terms of, there's always a delay in information, and we're not involved necessarily in the programming of the allocation of vaccines to which providers in the community. So at that point in time, I'll just make one other comment, and then I'll shift over to Dr. Morrow to undo whatever I said incorrectly. But just so that you know as well, for your friends and neighbors who may need this assistance, we did just receive a direct appropriation from the U.S. Treasury. That was part of the most recent aid package that was adopted by Congress. And so we have about $8.2 million that came to Kitsap County for rental assistance. And what's different this time is it's not just for individuals, renters, but landlords can also apply on behalf of their tenants. So there's kind of two ways to approach the program for those who have need, either in arrears or they're still in unemployment and need assistance going into the future. And the other component, which is different than the last time, is that actually will assist with some utility needs as well. So for those folks who haven't been able to keep up with their water bill, their electric bill, that type of thing, there also will be assistance. And so we're working on those contracts, and most likely will be predominantly going through Kitsap Community Resources, as well as Housing Kitsap to distribute those dollars. So Dr. Morrow, I'm going to hand it over to you.
Where are you?
Thank you, Rob, and nothing to correct in any of that. And are you able to hear me okay?
Mm-hmm.
Yes.
Yeah, okay, so my name's Gib Morrow, and I've been the health officer since August 1st, exactly. I actually started here in Kitsap on the 27th, and have been through at least half the pandemic in this community. I did the first half in Whatcom County. You know, I want to just say at the start that spring is on the way. You know, the sun's shining, the crocuses are coming up, we're starting to see some robins. You know, I think we're in a place where, you know, the weather is unsettled, as is, I think, what's going to happen next. And that's true for a variety of different reasons. And if you look at what's happening in terms of case rates here in Kitsap County, as well as regionally and nationally, we are definitely seeing a downswing. The peak was back on January 8th, and that's dropped down from thereabouts to about 120 cases per 100,000 over 2 weeks. And that's a big drop. That's a great thing. At the same time, you know, we're seeing a lot of vaccinations getting delivered. And we've had about 35,000 Kitsap residents that have received at least one shot. And many people in this community are fully immunized at this point. That really does not change anything with respect to all the other interventions that Rob mentioned that we really do know work. And so we encourage you to continue doing that, doing those very important things. I think we are poised to go along with our neighbors across the water and perhaps be advanced into phase 2. The implications of that are that, you know, we may start seeing people eating indoors in restaurants. We may see, you know, competitive sports. We may see more people in gyms. We at the health district are not really determining that. That's all being done with Kitsap as part of the overall broader Northwest region, which also includes Clallam and Jefferson and Mason counties. And the metrics that drive that determination about whether or not we kind of reopen certain sectors of society that are, you know, restricted at this point is really determined by case rates, by occupancy rates in hospitals, by number of hospital admissions that are occurring, as well as by the, you know, percent of all COVID tests that are run that are positive. And so those are being tracked at the state level. A lot of that data we have at the county level, but have not you know, been able to kind of line up our timing and ensure its accuracy. And because this is a state and governor driven system, we are, you know, deferring and going along with whatever that recommendation is. It's not directed at the county level. As Rob mentioned, neither are the vaccines. So, you know, the good news is right now that we've probably had about a third of our population nationwide be infected at this point, and thus have some degree of natural immunity to this. We don't know the extent of the degree of protection that that confers, but reinfections are pretty rare. And so, we're approaching high levels of immunity via, prior infection at the national level. We're also looking at 10 to 15% of the population receiving vaccines at this point, and that is an additional degree of protection. But at the same time, we're seeing these circulating strains, the variants from United Kingdom, which are more infectious and create higher viral loads in people who are infected. We believe that the vaccines work against those, but people, spread this a lot easier, and that's why the continued importance on those mitigation measures of wearing masks and trying to stay apart from each other, really trying to minimize the degree of social contacts that you're experiencing, will continue to be important. We don't really know the extent to which having received a vaccine prevents you from being infected and or passing on that infection to other people. We do know that the vaccines, as well as prior infection and natural immunity as well, to some extent reduce the severity of your illness, but we don't know fully what that looks like in terms of transmission risks. So, there are a number of different competing forces, including broad, immunity and increasing levels of immunity in the community, but at the same time, more sort of transmissible strains and loosening of a number of the restrictions. And I think it's going to be interesting to see how that plays out over the next few months. I would encourage everybody to, when possible, always err on the side of caution, and I know that you want to hear and you want to talk about what's going on in the vaccination realm. I will try to speak to that a little bit at this point as well. And as you know, there are priority groups that are top priority for getting vaccinated, and because the risk of significant illness is so much higher in the elderly, and in particularly in elderly folks who are in skilled nursing facilities or other congregate environments, that was the absolute top priority, as were our healthcare workers. So that group, we think, has been fully immunized, or at least everybody who's a worker in a healthcare setting or who lives in an assisted living facility or in a skilled nursing facility has been offered a vaccine, and those that want it have received one. As of January 18th, and again, this is driven at the state level, we did open vaccinations to everybody 65 years of age and older, as well as people 50 years and older who are caring for, a parent or a child or living in a multi-generational household. So, but we hear repeatedly, all the frustration that each and every one of you is either still experiencing because you haven't been vaccinated yet or has had to go through. And it's, to be fully honest with you, it's a matter of imbalance of supply and demand. When the state came out with their vaccination plans, I read those in great detail, and nowhere in there did it ever really say who was going to be doing the vaccinations. And, I'm watching PBS NewsHour and seeing these vaccines roll off the conveyor belt by the thousands and thinking, oh my God, who's going to be given these shots? And we did everything we could at the local level to activate our medical community, the healthcare delivery system, the local hospitals, the federally qualified healthcare centers. I put out personal appeals to all of these different provider organizations, including your doctor. Each and every one of you, I think, heard from us at the Health District about, please enrolling and engaging and assisting in these efforts. And we got great uptake. You know, we saw St. Michael's stand up to the challenge and vaccinate people. We saw Peninsula do that to get through that early, you know, first tier, the 1A folks who are in healthcare, and we also have at this point 38 provider groups that are enrolled and ready to give vaccines as soon as they become available. And it truly takes a village to get this degree, this volume of vaccinations delivered to a community. It takes multiple points of access. It takes a lot of different organizations. It takes a really an all hands on deck approach. And you know, what we've realized is that we've got the capacity to give the shots when we get those vaccines. We are just literally not getting them. And so the numbers are improving, and I can show you what that looks like in a minute. I think it's important to see that there is a significant degree of progress being made. But you know, for us at the health district, we stood up a high throughput vaccination program 3 weeks ago and easily administered 600 plus vaccines a day to people who were able to get enrolled and registered in that process. They didn't have to wait. They weren't standing. And there's one photo in the sun of people wrapped around the block, but that was before we even opened. And as soon as we did, we got people through and out the door. And I talked to numerous people who were, you know, really happy they'd showed up early for their appointment. And even with a 15 to 30 minute observation period, they were checking out and going home before their scheduled appointment time. And so, you know, when we have the vaccines, we can administer them. If we don't have the vaccines, we just absolutely can't administer those. So, you know, who gets the vaccines is determined completely by the state Department of Health. There are a number of, you know, high profile, you know, vaccination delivery programs that have been set up through the governor's office and the State Department of Health. You've heard about the 4 quote unquote mass vaccination clinics that are in Kennewick and Ridgefield and Wenatchee and Spokane. Those are, you know, getting 600 or so people through each day. They're getting a lot of the vaccines sent to those sites. You know, we can do it here when we get the vaccines, but we just haven't been getting them as fast as we would like to be getting them so that we can give them to you. The good news is that Kitsap County is actually getting vaccinated, you know, ahead of the rest of the state to a certain extent. You know, we've vaccinated about 14% of our population has received 1 shot overall. That beats the state average at this point, and it is also ahead of the national average. So, and in terms of you know, localities that are doing particularly well, Bainbridge is leading the pack in terms of the number of people who are over 65. I think about 55+% of those over 65 living on Bainbridge. Well, actually, let me back off on that one because that's not fully determined at this point. But Bainbridge is doing a good job, is leading the pack in terms of getting access to vaccines. So you know, I'm happy to show some data or take questions or leave it at that. I don't know if there's anybody kind of moderating the discussion, but I'll stop talking.
Bill, yeah. Bill, the president, Bill Luria, has been moderating, and I see he's back.
Right.
I'm Reed. I'm the director. Thank you both for attending. And so, Bill, I'll hand it back to you, I guess.
Well, I just want to turn it over to the membership if they have any questions for Dr. Morrow.
Well, I'll ask one. I'm
Okay.
curious about the kind of feedback that you're getting. I know that from the state, from the Department of Health, I know that they've been frustrated, just like you've been frustrated, just like our members have been frustrated. Does it look like if we are patient that the that the flow of vaccine, that the distribution is likely to improve, that you'll be able to stand up those mass vaccination clinics? I know here on the city of Bainbridge Island, the city and Bainbridge Prepares and the Bainbridge Island Community Pharmacy have been trying to do similar things. Does it look like there's hope if we just try to breathe deeply and wait?
Yes, absolutely. The vaccines they're rolling off those conveyor belts, and they are getting shipped out across the country as soon as they do. And I think that they're, despite what looks like, a bit of a confusing picture, I think they are getting distributed, across the nation in a way that is keeping everybody, relatively on track to receive them. I think that the production is increasing, and we're still as of a week ago, I think that the enrolled providers were getting about a third as much as they were requesting, and that's where it still seems to be sitting. Although at about this time, I think it was mid to late February, it looked like the state expectation for allocations that would be coming to the state of Washington is expected to ramp up, and it's likely to go, from that, initially it was about 100,000 vaccines a week, and it's been up about 150, 200,000, and we expect that's going to continue to increase, and we're hoping that it'll settle out, at a higher level here in the near future. So, yeah, I mean, it's hard to keep asking people to be patient and, be patient again, and keep being patient. But I know that's what's being asked of you, and it's good advice.
Okay, Robin, you had a question?
Okay. I have a question. I'm willing to be patient to get the vaccine, but what is trying my patience is the registration process online. And I have a suggestion, whether or not it's workable, I don't know. For example, with the senior center slots this week, I was go through all the form online and then get to a spot where I had to have a photo of my Medicare card or proof of eligibility. Then I would have to get off the form, go take a picture, try to attach it, by which time all the more spots were taken. And so what I'm suggesting is, and it would be really helpful for anybody, but especially us seniors, if there could be some sort of a pre-registration process where we record all that information, proof of eligibility, so that when the time comes to sign up for a slot, all we have to do is show that we're already filled out all that stuff and then pick a slot and register. And I've had a lot of friends who've been frustrated and spending hours and hours, not so much waiting for vaccination, but with the process of trying to get a slot. This might help, but whether it's possible to streamline it, I don't know, but that's my question, sort of. Can you do that?
Yeah, and I think it's worth backing up for a minute and looking at the big picture, which is that we literally don't have a national healthcare system. We don't have interoperability. There's no standardization really of electronic health records and or registration systems. I'm not sure which organization that particular registration process was through, but I will tell you, with
Senior Center, whatever that was, so.
Yeah, it's Bainbridge Prepares in the city of Bainbridge Island, and they're using a system called TimeTap, which was grabbed in a hurry. And I think that your point is, the CHI Franciscan was using one method, Bainbridge Prepares is using another. I'm not sure exactly. I think you were using TimeTap for the public health district. And so there are challenges.
Yeah. So I've seen, I'm sorry, go ahead. No, I know Martha, Barbara, and Judith have indicated they might want to ask a question. Martha?
Hi, I just was curious about, I have a couple of friends who are elder that live in Kitsap County, not on Bainbridge, who are not computer savvy. And I'm trying to figure out what's being done in Kitsap County around vaccine outreach, sign up for people who are living independently, over the age of, frankly, 70. There's the sign up process, as indicated, is pretty fractionated. Is that a word? I'm not sure, but it's very difficult, and for people who are not computer savvy, it's impossible. So that's my question: sort of what's going on at the Kitsap County level to improve outreach.
Yeah, and that's a great question, and we're fully aware of that. And again, I think that this needs to be another multi-pronged approach. I mean, I think if if you are computer savvy and you're good at finding appointments and getting them, and you want to help people like that, I encourage everybody to do that. We are absolutely doing that at the health district. So we've got a list of people that have contacted us who have expressed concern about this. We're reserving a certain number of doses or a certain percent of doses each week. And we're also working with partners, and it's not just people that are, kind of computer or, tech challenged. It's a variety of other demographic and racial and ethnic groups that may be more reluctant. And we're really trying to, we've got an outreach team and a communications team, and we're trying to work with partners to identify who those people are that, really are having the most difficulty. I mean, and everybody's having difficulty accessing vaccines. So we are absolutely working on that, and we appreciate your feedback in that regard.
So I'm doing the best I can, but if I have people that are asking me, can I ask them to call the Kitsap County Health Department and I mean, it sounds like you're creating some sort of list that's tracking people. So is that the right guidance? I'm just looking for things I can do other than, I have actually helped a couple of people set up, but that's not kind of the systems approach. So should I have them contact the Kitsap County Health Department?
Yeah, and I think it's important to just recognize and just remember that people need to be working with their primary care providers.
Oh yeah.
The shots are literally going to Kaiser, and they're going to Franciscan Medical Group, and they're going to Virginia Mason Clinic on Bainbridge, and they're going to Peninsula Community Health Centers. And so I think that that's an important point of access, the traditional point of access, and I think that that's one that people need to just keep in mind. But yes, people that contact us directly, we are working to compile lists and try to do outreach to people that
Thank you.
Okay.
Can I piggyback on that for a second? And I think what it does, it also illustrates the lack of, Martha, you talked about that systems kind of approach, and the fact from the state on down, the way that the vaccines are being distributed are to registered providers, right? And so each one of those registered providers, there isn't one plan for outreach or communication. Everybody's doing it a little bit differently, and that just continues to exacerbate sort of this a certain amount of confusion.
Thank you.
Can I also piggyback on that? Kitsap County Public Health yesterday sent out a message that they were not making any appointments for people who were trying to get online, but rather save this week's allocation of vaccine for people that had contacted them that could not get on, weren't computer savvy, that needed the vaccine, and said, please call us if you're in that situation, and gave the number as 360-728-2219. So, I mean, they are trying to cover folks who don't have online access.
Thank you.
Okay.
And I will add that that number is on our website. If you go to the Bainbridge Island Senior Center website, biseniorcenter.org, and look for the coronavirus on the bottom of the front page, there's a page that's full of all kinds of connections. But as Commissioner Gelder said, it's a patchwork. And so it's challenging for everybody. And we know it's particularly challenging for people who lack technical capabilities.
Thank you.
Okay, can you hear me? This is Bill. I'm having some problems. I know, Barbara, you wanted to have a question?
My question had to do with something that was brought up already, and it's certain groups of people who are opting out of not just the testing for COVID-19, but getting the vaccine. And one thing that prompted me to think about this is listening to somebody representing nursing homes and saying that a lot of the women who worked in these nursing homes or retirement homes who were of childbearing age were not signing up to get the vaccine because it had not been tested on pregnant women. And then some of my younger relatives asked if it had been tested on African Americans, meaning when they did the research, which groups were included? And so I've been thinking about that, and I haven't found any information on it. And I was just wondering if you have any information.
Yeah, thank you. I mean, that's a really important point. And I think that, you know, there are populations that are going to be more vaccine hesitant than others. And I think that people of color in particular are you know, in that camp primarily because of, you know, the history, you know, that I think we're all aware of, as well as some of the ongoing and current, you know, structural inequities in our healthcare system. And, you know, getting vaccine delivered equitably to those populations is absolutely a national and a local priority. And we're working with local providers and, you know, providers of color, because I do think that there's a real benefit to having, you know, people, you know, hear it from people that look like they look. And so, you know, I think that's a really important point. These vaccines have been tested in minority groups in a proportionate way, and they've been shown to be safe and effective in those groups. You know, the pregnancy issue is not a reason not to vaccinate. I think it's a reasonable situation for a person who's of childbearing age or who is pregnant to talk it over with their personal physician prior to doing it. But there is no reason that they shouldn't be immunized, and they're certainly eligible for that, and they wouldn't be turned away, and we would encourage it. So I think, you know, we're trying to get as many people to pursue, you know, vaccination as you know, as we can. But thanks for those points.
Thank you. Judith, I know you had earlier had a question.
Well, I didn't really have a question, but addressing the lady that spoke earlier about having problems with her Medicare card and her medical insurance and her driver's license. I'm part of BEMER, and which is the City of Bainbridge Island medical group, emergency medical group with Anne Lesage. And I've been vaccinated. I've had my first, and I'm getting my second vaccine on Friday. And I found that when you go to the senior center to get your vaccine, if you haven't produced your documentation initially, if you just take it with you, a driver's license, a copy of your current medical insurance that's apart from your Medicare, if you have that, and the Social Security card that's encrypted, not the one with your full Social Security number on it, the one with all the jumbled up numbers and letters and things on it, if you know what I'm talking about. Those are the three things that they require, and you can do that on site with the BEMA group that's doing vaccinations, and they're doing them Friday and Saturday at least of this weekend for people who have already signed up for appointments.
Dr. Morrow, did you want to comment at all?
Yeah, no, we're aware of that issue, and we're addressing that, with the State Department of Health, and actually Bainbridge Prepares is likely to be a good partner in terms of getting vaccines delivered out to smaller adult family homes, for example, that may not have enrolled in the federal pharmacy partnership program, as well as to truly homebound individuals. I think, there are other opportunities there, and that may be a situation where a primary care physician may be able to get a home health delivery to a person out at their home, but that's absolutely something that we're aware of and are trying to monitor and track and address.
Marilyn, did you really want to talk to Dr. Morrow? If not, I know Kimmy, you have a question.
Oh, yeah. Am I on?
Yes.
I have a question probably for Rob as well, because you're saying that 14% of Kitsap is above the state average. And I know there's a national priority to reach the served communities, the Black and the Indigenous and the Latinx communities in particular, who have high death rates. And of course, a lot of that intersects with, I think they just have, oftentimes it's also related to poverty and having access to technology, and then just understanding the system, because they're not, oftentimes don't have insurance, which we would definitely connect to our primary caregivers. And so of the, and we may boast that Bainbridge is getting more than its share statistically. And I just wonder, unless we are gathering demographic data, and I know the tribes have gotten their vaccinations, and I think that's probably part of the federal effort to reach these communities, and I applaud that. But as far as I know we have large pockets of Latinx communities that are in Kitsap, and large Black communities, and I'm just wondering if there are efforts to actually count those numbers and see if it reflects the county population as a whole in services.
I can jump in, and then Dr. Morrow, you can round out my errors. So I think that it's a couple of points I'd want to make. One being that there is the intent from the state level to be able to address some of the equity issues in the distribution of the vaccine. The challenge being, again, it gets back to how it's being distributed, that they aren't providing that equity and accessibility plan for each of the providers, but yet they're distributing to each of the providers, and there's a trust that whatever the plan that provider's utilizing or creating is actually rounding out and kind of mirroring what that intent is. So I think we can probably only speak to the Kitsap Public Health piece of it, and that is an effort that's underway. But you would also look, if you kind of review sort of who receives the lion's share of doses in the community, that would be Peninsula Community Health Services, as probably, I would say, fairly consistently received the most. And they are our federally qualified healthcare center. So they are generally the ones that are serving predominantly those population demographic segments that we have that are either low income or communities of color, et cetera. So they probably have a disproportionate amount of folks that they're serving. At the same time, even in this morning's paper, they were mentioning that, that demographic data of who's receiving the shots, they haven't done a great job in the interest of trying to move people through and get it done. They weren't really good at sort of tracking who was getting it in terms of the demographics. So, and that requires each and every provider to fill out that information, get that to the state so that we have that data of what the breakdown is. So there are data gaps. And so I would just toss it over to Dr. Morrow.
Yeah, thanks. And again, the health district just as of Monday finalized a data sharing agreement with the State Department of Health. And I, right prior to this meeting, was looking through that information with our epidemiology team. And we anticipate that we're gonna be sharing that later today, or certainly before the weekend, in terms of how we're doing with different age groups, different geographical groups, different racial and ethnic groups. And I will say that the Alaska Native American Indian community is doing well. They're at, in terms of the numbers, I think 28% of the population over 65 has been vaccinated in that cohort, and it's a little bit less than that, right around, I believe, 26 or 25% for Hispanic. Black people are really fallen behind, I think. And I met yesterday with some members, some physician in that community who's very interested in working with us to develop programs that will address their concerns, set up listening, and discussion opportunities, bring in people of color to, again, address that hesitancy issue. But right now, it is, I think, the priority is about doing what we can to maintain equity and promote equity, but to also get the volumes delivered. And I think that as we progress in the imbalance, this huge imbalance of demand over available supply, as that begins to correct, we can really, kind of start to focus those efforts and do a much better job. But we're absolutely starting that work and those discussions. And I think a large part of that is going to involve, making it easy and doing it in places that are comfortable for people. And I think there's some wonderful opportunities here in Bremerton to make that happen. So those are important points, and thanks for raising that.
Thank you. I'd like to maybe bring some closure to this. I want to really thank you, Commissioner Gelder and Dr. Morrow. I think we had 70 people participating in this, so there's strong interest. So thank you.